All right, thanks everyone for joining Stop TB Canada's national call today. My name is Lee Raceby. I'm a policy and advocacy officer with Results Canada, where my work focuses on building the political will to end TB. And in this role, I'm also a member of Stop TB Canada's steering committee secretariat team. So these calls, Stop TB Canada's national calls, are intended to keep our network updated on our current priorities and our projects, as well as connect with all of our colleagues working on TB across the country. So please feel free to connect in the chat and contribute to the discussion to get the most out of this meeting. So today's call is dedicated to World TB Day, which is just over 1 month away on March 24th. So we want to ensure that everyone working in the TB space in Canada is aware of the campaigns and activities that are happening this World TB Day, and so for you to know how you can get involved if you're interested. For today's agenda, we'll start with an overview of the annual grassroots movement to light monuments up in red for World TB Day. We're then going to cover Stop TB Canada's World TB Day plans, including our key asks of the government in relation to our global and domestic campaigns. We will then dive into the importance of this year, in particular for TB and accountability. We'll cover Stop TB partnerships, or Stop TB Canada's participation at the Union NAR TB conference, which is happening in Vancouver next week. And then we'll open it up to hear from all of you on what you and your organizations are planning for World TB Day. So to kick us off, I will pass it over to my colleague Victoria to talk about the initiative to get monuments across Canada lit up in red this World TB Day. So Victoria, over to you.
Hi, everyone. So as you may know, March 24th, 2023 is World Tuberculosis Day. It's a day dedicated to raising awareness and standing in solidarity with communities affected by tuberculosis. Each year, Results Canada participates in a grassroots movement in collaboration with other organizations and volunteers to light up prominent Canadian landmarks red to commemorate this important day. So presently, we have 26 monuments confirmed to be lit on World TB Day this year, with more to be confirmed within the upcoming weeks. Last year, we lit over 40 monuments, so we're hoping to surpass that this year. To support this movement, you can request a monument in your riding to be lit red using the resources that we've shared in the chat. We are also encouraging individuals to take a photo with any of the monuments that are lit red on World TB Day and to share the photo on social media. You can refer to the resource shared in the chat for an up-to-date list on all of the monuments that are confirmed to be lit up. Also, when you do post on social media, remember to tag the Member of Parliament relevant to the riding the monument is located in so that we can amplify this movement as much as possible. Thank you.
Thanks, Victoria. Yeah, so we hope to see lots of photos and media around this initiative to raise awareness for TB and get the attention of decision makers. So when you're posting on social media, please try to use these hashtags that the Global Stop TB Partnership has put together for their World TB Day theme this year, which is Yes, We Can End TB. And that's the message that we're trying to convey to the public and to decision makers, that with political will generated and funding provided, we can end TB. And our campaigns highlight 2 concrete ways that Canada can support this effort. So Stop TB Canada always works to include both domestic and global asks, as our mission as a network is to end TB at home and abroad. Excuse me. So I will run through our global and domestic asks that we're calling on Canada to act on in support of TB elimination. So starting with our global ask, in relation to the global TB epidemic, as most of you will be aware, TB elimination efforts have been devastated by COVID-19 disruptions. And over the past 2 years, we've seen both the incidence of TB and the total number of deaths from TB increase, with 1.6 million people dying of TB in 2021 alone. And one of the greatest barriers to ending TB is the fact that each year, approximately 4 million people with TB are missed by health systems and therefore don't get the diagnosis and the treatment that they need. And reaching the missing millions is imperative to global TB elimination and is the primary focus of Stop TB Partnership's TB Reach initiative, which is an innovative financing mechanism that effectively locates people in hard to reach communities so that they can access the care that they need and would otherwise go without. So Canada is a foundational donor to TB Reach, leading support for its programming since its inception in 2010. And with sustained support from the Canadian government, among other donors, TB Reach grantees have screened more than 40 million people for TB, resulting in over 2.6 million people being diagnosed and put on treatment. And this work has saved approximately 1.3 million lives, as well as helped to stop TB from spreading within communities that are placed at risk. So just a bit of background on Canada's investments. In 2015, Canada committed a 5-year pledge of 85 million to TB Reach and renewed its commitment with a 1-year investment of $11 million last year. And Canada's contributions to TB Reach have been essential to the initiative's impressive results, but we are seeing that Canada's investments are decreasing. And because of this, at a minimum, we're calling on Canada to maintain the 2022 level of investment in this life-saving mechanism by pledging $33 million over 3 years. And continued support for TB Reach is critical to ensuring continuity of care, especially given disruptions to programming caused by COVID-19. And we know that TB Reach is well placed to fill some of the gaps in service provision during the pandemic because the initiative supports community-led programs in isolated communities around the world. So we're really working to ensure that Canada maintains its investment in TB Reach so that millions of people affected by TB will not continue to be missed. To learn more about our global campaign in support of TB Reach, you can check out our campaigns page that is or should be posted in the chat. I think it is. And there's also a click to tweet ready for you to go if you'd like to take a really quick and easy action together right now. And maybe I'll just take questions at the end. So I'll just cover our domestic ask. On the domestic side, our ask is related to Canada's commitment to ending TB by 2030, but its lack of a plan to achieve this. So in alignment with the newest edition of the Canadian TB standards that came out last spring, we're calling on the government to establish a national TB elimination strategy that would include specific commitments, guidelines, and the funding required to address the factors that are currently impeding TB elimination in Canada. So with the Canadian Thoracic Society, we've identified 5 key recommendations to help inform the government in developing a national TB elimination strategy. You may have seen this one pager before, as we have been circulating it within our network over the past couple of months. But these 5 recommendations include: 1, improving TB screening strategies among high priority groups; 2, addressing the social determinants of health and barriers to TB care; 3, improving access to essential medicine for TB treatment; 4, implementing a timely TB surveillance infrastructure; and 5, adopting accountability, monitoring, and evaluation measures for programming. So we sent this one pager articulating our ask to all members of Parliament, requesting a meeting with them and ultimately trying to get them to sign on to a letter of support for a national TB elimination strategy that Stop TB Canada will send to the Minister of Health around World TB Day this year. So far, we have 5 signatures on the letter and really need your help in getting more parliamentary support for this initiative. So if you go to our domestic campaigns page on our website, that will be posted in the chat, there are step-by-step instructions for how you can email your member of parliament. There's a template email that you can use, and then we ask that you attach the one pager to your email and you copy hello@stoptbcanada.com. But all those instructions are listed on the website, as I mentioned. And I just want to thank everyone who has already taken this action. And then on the public awareness raising side of this campaign, we also have a social media toolkit available for you to share on social media. So there are pre-drafted tweets for each of these recommendations, as well as a graphic that you can include on Twitter. So feel free to use that social media toolkit. All of the graphics you can download right from that toolkit, and the tweets are click to tweet. So we've made it as easy as possible to take action. And feel free to write your own tweet as well, just tagging the Minister of Health and your MP. So those are Stop TB Canada's asks for the government this World TB Day. Your support in amplifying these campaigns would be really helpful in putting pressure on the government. But Stop TB Canada also has some activities planned to get the word out. So I'm just going to cover Stop TB Canada's strategy for engaging with the sector, including all of you, parliamentarians, and the public to have the greatest impact this World TB Day. All right, so starting with sector engagement, which we are kicking off right now at our national call. This also includes sharing events and resources from our partners in our newsletters and on social media. So please send us your events so that we can help amplify them with our network. We will also have quite a few members of Stop TB Canada's steering committee at the Union NAR TB conference next week, which we'll come back to shortly, but that will be a great opportunity to connect ahead of World TB Day. And we're also planning to host a webinar ahead of World TB Day with some of our partners, which will cover the importance of 2023 for TB and illustrate our network's roadmap ahead of the United Nations high-level meeting on TB that's happening later this year, which we will also come back to shortly. Next up, we have our political engagement strategy. So this includes engaging with members of parliament and relevant ministers. As I mentioned, Stop TB Canada has been emailing and meeting with members of parliament. As you can see here, we met with my MP, Arif Virani, a couple of weeks ago. We'll also be sending that letter of support with MP signatures to the Minister of Health in relation to our domestic ask for a national TB elimination strategy. And we're also speaking with the Minister of International Development in relation to our global ask and seeing if there's an opportunity to host an announcement moment for TB Reach around World TB Day in Ottawa. If anyone remembers, we had a really successful event last year where the minister made that $11 million pledge. So we're hoping to celebrate alongside him again this year. We're also hosting a parliamentary reception in Ottawa on March 21st for civil society and affected communities to meet with members of parliament and informally discuss what's needed for Canada to help eliminate TB. So there is limited capacity for that event, but if anyone based in Ottawa would be interested in participating, please reach out and I can follow up with an invitation. And then finally, we're also working with the Canadian Thoracic Society to get a member of parliament to make a statement in the House on World TB Day. So lots in the work on the parliamentary side. And then lastly, I will just touch on our public engagement strategy. So Stop TB Canada sends out monthly newsletters. So if you're not currently subscribed to our newsletter, you can do so on our website. Both the February and March newsletters will amplify events and activities happening around World TB Day. So again, please share any events today in this session or email them to us so that we can help amplify them. We'll also be amplifying events on Twitter and have a social media campaign sharing content from partners as well as our own content. So please engage with us on there. As part of this campaign, it includes the grassroots initiative to get monuments lit up in red on World TB Day. So we will be highlighting different photos of monuments lit up in red on World TB Day. So you can join us, as Victoria mentioned earlier, by visiting a monument that is going to be lit up in red on World TB Day, taking a picture, posting it on social, tagging your MP, just helping to get the word out and raising awareness. We will be hosting a webinar, as I mentioned before, around World TB Day to educate the public about TB and opportunities that exist for impact this year. And we will be publishing several op-eds and letters to the editor on World TB Day. And I would encourage everyone to take a stab at writing a letter to the editor in your local newspaper with the hook of World TB Day and just letting your community know and your member of parliament know that their constituents care about ending TB. And then lastly, we will be updating our TB tracker, which was launched last year. You may have seen this on our website. The tracker was created to serve as an accountability resource for Canadians to have a better sense of what Canada has committed to in relation to domestic and global TB elimination and how progress is tracking towards those goals. So my colleague Lena, who I don't think is on the call right now, but she is going to be updating the tracker with the most recent data, and we'll be updating this resource around World TB Day this year. So we will share that once it is updated. And then I'm just wondering in terms of time, because I know Elizabeth has to hop off at 1:30. Robin, if it's okay with you, can I get Elizabeth to talk about NAR before we dive into your session? Okay, perfect. So I'm just going to pass these two slides, and we'll cover Stop TB Canada's participation at the NAR TB conference next week. Elizabeth, over to you.
Thanks. So I don't know how many of you are able to be at that big TB conference in Vancouver. For those of you who are involved in TB care at all, it's the only big TB conference specifically about TB in North America. It's held every year toward the end of February, and it's a fantastic way to get up to date on latest clinical and public health developments in TB and TB care, and also to connect with other people who are doing the same kind of work. For years, Stop TB Canada and Stop TB USA have hosted a session at the beginning of the conference, usually focused around global TB issues. So we're doing that again this year. And the highlight of that conference session is a talk about the new global Stop TB plan. But there's also a couple of other things happening that Stop TB Canada is involved in. The first is we have an in-person meeting just for Stop TB Canada, not technically as part of the conference academic program. So anybody who's from Canada who's at the conference is very welcome to join us. It's going to be at 7:30 on the Friday morning. The other things that we're involved in are a pre-conference workshop on the Wednesday around advocacy and research literacy. And the other thing that Lee's put on the slide is a couple of people who are involved in TB People Canada are going to be also at the conference and taking part in a bunch of the stuff. And we also have a poster presentation about TB People Canada. And again, for whether your connection to TB is through TB care, or you have TB, or a family member has TB, TB People Canada is the only peer support group for people with TB that we know of. So it's peer run. It's not medical advice. It's truly people to people sharing their own experiences and support. And so we really want to encourage folks who take care of people with TB to know about it, and people who have TB or family members to take part. You can also find the information about TB People Canada on the Stop TB Canada website with a bunch of information about how to connect. So I will stop there and look forward to seeing anybody who's going to be in Vancouver.
Thanks, Elizabeth. And yeah, echoing that to say I'm really looking forward to meeting a lot of you in person in Vancouver. If you're trying to connect with Stop TB Canada, you can email us at hello@stoptbcanada when you're at the conference, and we can try and coordinate meeting up and connecting in person. Okay, so now I will go back. Oops. Thanks, Robin, for your flexibility. I will pass it over to Dr. Robin Waite, who is a member of the Stop TB Canada Steering Committee and consultant working on community and civil society engagement around the United Nations high-level meeting on TB this year. to speak about the criticality of this year in relation to accountability and the involvement of civil society. So Robin, over to you.
Great, thanks, Lee. Hi, everyone. Just wanting to flag, I'm sure a number of you are already aware that 2023 will be the second ever high-level meeting on tuberculosis happening attached to the United Nations General Assembly. The first one took place in 2018, and that resulted in a political declaration with a number of targets and commitments all states agreed to driving progress towards. So this year, it's a really important year because despite those targets and commitments that were agreed to, we know that all but one is in the green zone in terms of being on track to stay the course of achieving progress across those. So this year is a very important year for accountability and re-elevating the critical importance of high-level political engagement in the TB response. And the HLM is an opportunity to make that happen. So at the global stage, we're starting to coordinate with affected communities and civil society organizations and actors around the world to make sure that we are lining up the dominoes to make that moment in September as high impact as absolute possible. A couple of things to keep in mind if you're already starting to engage in advocacy around World TB Day and you're going to be tapped into what's happening at the HLM, we want to get heads of states as much as possible to attend the HLM. So in your advocacy asks around World TB Day, it could be great to have an ask for the Prime Minister Justin Trudeau to show up to that high-level meeting that's tentatively scheduled right now for September 22nd. It's also potentially a good opportunity around World TB Day to start forming relationships with your UN mission. So we want the UN missions to know that we as Canadians care about the TB HLM and want them to show up at the HLM itself. We want them to be pushing our community key messages, etc. So starting to form those relationships now is also important. What is being termed this year as the TB-HLM Affected Communities and Civil Society Coordination Hub, which is hosted by the Global Fund Advocates Network and funded by the Stop TB Global Partnership. We've got a landing page live now, which I'm going to share in the chat box. We're hosting monthly calls with partners around the world so that we are working in close coordination in the lead up to the HLM. We know that there's going to be, in addition to the HLM itself, a multi-stakeholder hearing that will be an opportunity for community voices to come forward in New York and start to shape what's going to be in the political declaration. That's probably going to happen sometime late April or early May. So that will be another moment for a big advocacy push this year attached to the HLM as well. And just to note that this year, there's two other aligned high-level meetings taking place, one on pandemic prevention, preparedness, and response, and another on universal health coverage. And both of these issue areas are intimately linked and connected to TB. So it'll be important for us to elevate TB within those forums and also to be collaborating with our partners and colleagues in those spaces so that we're sharing lessons learned and resources across communities as and where it makes sense. Next slide, please. Another activity that's happening at the global level that's important for everyone to be aware of is the development of the Deadly Divide 2.0 report. So in 2020, you might have seen that the Stop TB Partnership delegations launched this Deadly Divide report that we can see on screen. And it looks at how there's deadly divides, as I was saying earlier, between the commitments and targets and the reality of progress on the ground. So there's a big effort happening right now to update this report. There was a big consultation earlier in the year. We engaged Stop TB Canada partners in that consultative process. People were engaged all over the world. And this report, when it's launched, it's due to be launched around World TB Day at the Stop TB Global Partnership board meetings. This will form the basis of what our community asks for the high-level meeting are going to be. So of course, we're going to need to localize them and adapt them to our different contexts, but this will be the basis for what we want to see coming into that political declaration. So keep in mind that there's going to be some sort of social media toolkit, some sort of big launch of this happening around World TB Day 2. So pulling that into your your advocacy as a core asset and into your HLM engagement would be really helpful. And again, I'm going to share the link to the Coordination Hub landing page right now. You can sign up for the listserv, the TB Civil Society listserv, to stay up to date on what's happening on the HLM, and also register for upcoming calls as and when needed. And there's a ton of resources available there for you now so that you can learn more about what an HLM is and why it matters for us to engage at this critical time.
Thanks so much, Robin. Speaking on behalf of Stop TB Canada, I'm looking forward to engaging around the UNHLM, and hopefully we can make it as impactful as possible. So we'll definitely be circulating the resources that you just mentioned with the Stop TB Canada network as they come out and are available. Okay, so I'm just going to get back to the slides. So now that Stop TB Canada has covered our plans for World TB Day and flagged some opportunities that are coming up for collaboration, I just wanted to open up for others on the call to share your plans for World TB Day, whether you are writing an article, hosting an event, developing social media content. Let us know, and we'll do our best to amplify and increase the reach and impact of each activity. So opening up the floor now, feel free to just go ahead and take the mic, or you can use the raise hand function. Go ahead, Jessica.
Hi, everyone. Jessica here. I'm one of the TB nurse educators at the BC Centre for Disease Control, and I am going to be one of the volunteers at the NAR conference next week. So hopefully I'll see some of you at the registration table or around the conference. I just want to acknowledge that I am joining from the traditional unceded territories of the Squamish, Musqueam, and Tsleil-Waututh nations. I'm grateful as an uninvited guest in this territory to be able to live, work, and play in these lands and waters. And very excited to see a lot of you in Vancouver, hopefully next week. Here in the city, I'm not sure if Men is on the line or someone from the BC Lung Foundation, but we are going to be doing a World TB Day booth with awareness and education for public and healthcare professionals at Vancouver General Hospital in the city of Vancouver for World TB Day. We also, for the first time this year, have the city of New Westminster, where our other TB clinic is located, lighting up City Hall in red and doing a mayoral proclamation declaring World TB Day in the city. We've also applied to the city of Vancouver as well again this year to do a mayoral proclamation declaring it in the city for World TB Day. And then the BC Centre for Disease Control is within Provincial Health Services Authority, so we'll be working with our communications folks to share some of the World TB Day resources that come out from the Stop TB partnership, and also hoping to get the nurses and various people working in our clinics wearing red or Stop TB Day pins, and then doing group photos and posts around that. So that's kind of what we're looking at doing in Vancouver.
Amazing. Thanks for sharing all of that, Jessica. We'll keep an eye out for all of your comms around World TB Day, and great to hear that you have successfully gotten some monuments to light up on World TB Day as well. If you have any specific resources that you want to share in Stop TB Canada's newsletter, for example, feel free to email them over. Elizabeth, over to you.
Hi there. So I feel like, I work in Toronto at the TB program in Toronto, and I feel like we're at the other end of the spectrum from the Vancouver and BC folks. Our program was hit really hard by COVID. 75% of the TB program was redeployed to COVID. So I guess I'm speaking up for those of us that are not going to be able to pull off much this year. So we do have the CN Tower and the big Toronto sign lit up red. We're going to scramble and see if we're in time to do the mayoral declaration of World TB Day again. But other than that, all we're going to be able to pull off really is some social media stuff, which is fairly straightforward to do. But other than that, the main thing I think we're going to be focusing on is some kind of World TB Day celebration for our TB team, because it's been a really rough 3 years, and we're only just now starting through confessions to even be able to do contact follow-up for contacts of TB. So we wanted to have a World TB celebration that is in part about having our team like back together and actually up and running again. So that's where we're at.
Thanks, Elizabeth, and thanks for trying to pull something together, even though you have limited capacity. But let us know if you need any support with if you do try to put together some sort of meetup around one of the monuments in Toronto that are going to be lit up. We can try to amplify that and get more people to turn out.
Sure, and we'll make sure to tag you on the social media stuff.
Perfect. Andrea?
Hello, Andrea Monahan. I'm with Indigenous Services Canada. I'm the National Program Coordinator, and I am joining today from the unceded and traditional territory of the Algonquin Anishinaabe, also known as Ottawa. I just wanted to share that our team is planning a webinar to promote Chapter 12 of the Canadian TB standards. So that is the chapter around providing culturally competent care to Indigenous Canadians, First Nations, Inuit, and Métis. So we have folks from AFN and ITK who will be facilitating that webinar, and we're also hoping to have an Indigenous person affected by TB speak to the care that they received and whether or not it was culturally competent and or how it could have been more culturally competent. So we will definitely be sharing that information and the promotion of it with Stop TB so that, yeah, hopefully it can be shared out to others as well.
Yeah, that sounds great. Looking forward to join. Do you have a date for that session?
So we're planning March 23rd, just
okay.
Still waiting to confirm it. And also I'd just like to mention, it's we're hoping to, like, our target population for this webinar is really individuals, healthcare providers who may see Indigenous patients, but it's perhaps not the primary population that they see. We've already done quite a lot of promotion amongst sort of the organizations that do work primarily or with ISC, basically, with Indigenous Services Canada, but really looking to connect with some of those people who may not have already seen this information.
Great. Sounds good. Robin?
Yeah, just Andrea's sharing just prompted me to think that I should share this too. The Deadly Divide 2.0 report that I mentioned will elevate that Chapter 12 of the Canadian TB standards within the document in some sort of case example way of saying this is good practice that other countries could start looking to do as well. So that will be in the Deadly Divide report. And then if there's any appetite or interest to have international partners at that call, or maybe to do an international focused targeted similar webinar, I think there'd be a lot of interest in that. And I'd be really happy to help kind of broker that conversation with the Stop TB Global Partnership if helpful.
That would be amazing. I will send you an email.
Would anyone else like to share your plans around World TB Day? I don't think Trevor is on the call, but I know that Can is launching a series of podcasts around World TB Day, so we'll definitely be amplifying those once they're available.
I think the landing page is ready now. So we could share it now even.
Perfect. I don't have it open right now, but I can definitely follow up and start sharing it in the February newsletter. Nathan?
Sorry, just had to mute myself. In Winnipeg for the WRHA will be communications has been absolutely great with working with us this year. So we're planning to have an article highlighting World TB Day in the Winnipeg Free Press the week of March 24th on the Saturday. So I believe that's the 16th, I think. No, the 18th. We're also doing a lunch and learn where we're going to have our one of our MOHs go over recent stats, and we're going to do a quick TB 101 and a case presentation. We are going to be not advertising. We're going to be what's the word I'm looking for? Highlighting World TB Day on the WHA's Twitter, LinkedIn pages. They're also going to highlight one of the nurses from the public health team. They use it as part of communication, uses it as part of their LinkedIn campaigns to highlight different programs in the WHA. So they're going to highlight one of our TB nurses. We have 5 buildings to be lit up. It's going to be the Esplanade Bridge, the Convention Center, the City of Winnipeg sign, and the Legislative Building. That's 4. There might just be 4. And I think that's it. But the mayoral proclamation seems really interesting, and I see in chats that there's a email to ask someone more information about that. So we'll also look into that. So that's what we have.
Great. Thank you for sharing, Nathan. That all sounds amazing. And let us know if there's anything that we can do to help promote any of those events.
Thanks. We'll send you a list of what we're doing. If
Perfect.
it can be on your webpage, that'd be greatly appreciated. Thanks.
Of course. Anyone else? Robin?
Sure. Just like, I guess to get a bit more specific with what's going to come out from the TBHLM coordination hub. So we're planning on putting out a scorecard asset, maximum 2 pages, looking back to the 2018 TBHLM targets and commitments and giving like a quick like red, yellow, or green scorecard. So that asset could then be used in advocacy. And we're going to send out like template emails that people could use to send to their heads of states with really pretty invitations to the HLM saying, we want to see you show up at the HLM itself. So there'll be a bit of an advocates toolkit that comes out on World TB Day for everyone to use.
Great. That sounds like a really useful tool that we can circulate. Yep, and then Ekta just reshared the list of monuments in the chat. So if you want to see if there's a monument that's already confirmed to be lit up in your riding, you can check that out on the list. And if you don't see a monument that's near you, you still have time to make a request to get even more monuments lit up in red this year. Okay, I think that's a really great list of events and resources that are being produced for World TB Day. I'll just reiterate, you can continue to send me any events or resources that you would like Stop TB Canada to amplify. We're more than happy to include it in our newsletter, on social media, and with our network through our various comms channels. And just one last note on the parliamentary reception that I mentioned earlier that Results Canada is planning on March 21st. So this isn't an open invite. So if you are based in Ottawa and interested in participating, just shoot me an email at hello@stoptbcanada.com and I can get the invite over to you. And hopefully it will be a really great event covering both domestic and global TB elimination efforts and an opportunity to meet with decision makers. So on that, I think we'll close the call. Thanks everyone for joining and good luck with your World TB Day planning.
Lee, can you stay on for a second if
Nope.
you have extra time?
Thank you.
Thanks.
Bye.